Hello, my name is Keith Ashman from Analytical R&D Pty Limited, presenting a proposal that will enhance New South Wales' position as a global leader in precision medicine. By bridging a critical technical gap in immunology, we are launching a service and building a sovereign capability that directly delivers on New South Wales' 20-year R&D roadmap's vision to produce world-leading technologies and sustain globally competitive industries. Cytokines are proteins that orchestrate the immune system's response. It is imperative to know the immune system status to understand a patient's immune response to infection or disease. The margin of error in regulated early-phase clinical trials is shrinking rapidly. Predicting a cytokine storm from an immune response is a matter of life and death. Pharmaceutical developers require absolute pharmacokinetic and pharmacodynamic fidelity to ensure patient safety. Regulators are increasingly demanding higher structural verification. Precision medicine is hitting a bioanalytical blind spot. Traditional ELISA and Luminex tests, the current standards, rely on antibody handshakes that cannot distinguish between biologically active and inactive proteoforms. This leads to a summed signal that masks the biological state, potentially allowing lethal cytokine storms to go undetected in clinical trials until it is far too late. These traditional tests suffer from significant cross-reactivity and matrix interference, particularly when evaluating samples like human serum, where interfering proteins change with disease progression. There is a need for a method that provides the high sensitivity of an immunoassay coupled with the structural certainty of targeted LC-MS. Mass spectrometry replaces shape-based guesswork with exact molecular mass. This is a sequence-based approach that distinguishes between proteoforms and modifications that share identical antibody epitopes, thereby producing specific rather than summed signals. Our solution is the hybrid immunoassay LC-MS platform, a best of both worlds approach. We combine the enrichment power of immunoaffinity with the sequence-level certainty of mass spectrometry. By using stable isotope-labeled peptides as internal standards, we provide absolute quantification and proteoform-level resolution, the ability to see protein variants and modifications that standard tests miss entirely. This method ticks all the boxes. Analytical R&D has the world-class infrastructure, method development expertise, and the cross-disciplinary team to execute the project. The opportunity is to deliver disease-specific molecular assays to desperate markets. Analytical R&D is headquartered in one of the world's powerful R&D jurisdictions. Government mandates de-risk commercialization and drive scaling capabilities. This project is well aligned with the New South Wales Government's strategic priorities. We directly support the biotechnology theme of the New South Wales 20-year R&D roadmap and the local manufacturing mission of the New South Wales industry policy. By developing these high-value complex services locally, we foster a sovereign capability that helps make New South Wales the innovation powerhouse described in the New South Wales Innovation Blueprint. We are a NATA-accredited SME located in a key innovation precinct, ready to scale this project immediately. The economic stakes are high. The global cytokine market is valued at over $106 billion in 2026 and is projected to exceed $170 billion by 2033. As the pharmaceutical industry develops second-generation interleukin-targeted therapies, there is a massive unsatisfied demand for the regulated GXP-compliant bioanalysis that our platform provides. By keeping this R&D onshore, we enable Australian biotechs to leverage the 43.5% R&D tax incentive while creating skilled, high-value jobs for New South Wales biochemists and specialists. The technology is validated. The pharmaceutical industry needs absolute accuracy. The government is actively funding the ecosystem. The time to act is now. Let's go from policy to protein and define the gold standard for the next decade of precision medicine. Thank you for listening.